guys, and welcome back to my channel. Before we get into it, yes, I did get a new haircut. I'm awfully excited about it. It just lets me get more things done because it's a lot easier to take care of. But if you didn't see it, I did post a picture on my Instagram. If you guys don't follow my Instagram, definitely go back to my last video and click the description link and go ahead and give me a follow. I post on there about a lot of the stuff that I'm learning, and I honestly really love the community that I'm building on there. So definitely go give that a follow. So I got a lot of requests on my Instagram to talk about my shadowing experience. And I think honestly my shadowing experience is a huge part of what I've been learning, and it's helped me in a huge way. So I have my schedule right here from my rotations so far, and I'm going to be referencing a lot of different departments, and I'll just explain what they mean, and hopefully it'll give you guys a better idea of what you would like to get into if you're looking to get into the medical field. So I guess before I start talking about rotations, I can tell you guys a little bit about my experience volunteering. So I volunteer at a small local hospital called Quakertown St. Luke's Hospital, and there's about 10 different branches of this hospital, and it's also a teaching hospital. Now, it's a very small hospital. It only has about 54 beds, but because it's a teaching hospital, I'm able to observe procedures, and as a student, I'll be able to gain experience just watching doctors and what they do. And this has helped me tremendously, because before you are able to observe or really do rotations in a hospital, it's kind of scary. Like, you don't really know what you're walking into. I remember my first shift, I was so scared. I didn't know what was going to happen. And you always hear those stereotypes where, like, the doctors are super mean to you and they treat you like you're the bottom of the totem pole, and it's just super scary to walk into. I put in about 130 hours at my hospital, and I have my badge here. This actually helped me get into the ER whenever I needed to run some labs from the ER down to the lab so that they can just get the lab results quicker. It's very fast paced. Working in a hospital is very quick, and if you're not able to stay on top of things, then working in a hospital might not be for you. But don't worry, if that's not for you, there are definitely a ton of other departments that aren't quite as fast-paced, but I personally thrive on the fast-paced, quick aspect of working in a hospital, and I love it, and that's part of the reason why I want to work in a hospital when I get older. I saw a lot while I was at the hospital. I saw a code blue, I saw some CPR and some resuscitations, just a ton of different cases. I'd walk in and there'd be like 30 people in the ICU, and I'd get to just meet up with every single one, see how they're doing, get them some water, and I got to hear a lot of their stories, and it's crazy amazing how many people just want to hear you talk, because a lot of them are going through a rough time. And it really opened up my eyes to what it's like working in a hospital and how many people come in, and just being there for people who are in need. And that's a super important aspect of medicine. But also, because I volunteered, they got me into the OR in a couple opportunities, and that was amazing. I got to go in full scrubs. They got me in the actual OR room just a couple feet away from the operating table, and I saw a knee arthroscopy. So a elderly woman tore her meniscus, and they were just going in to repair that. I saw a carpal tunnel revision. So what had happened is the individual had a lot of scarring where they got their surgery, and they had to go back in and remove some of the scar tissue. And the surgeon actually let me come like a couple of feet within the table, because they have what's called a sterile line. So I didn't cross the sterile line, but I was like right behind it, and that was super cool. And then the last one I saw, and that was probably the coolest, was called an open ankle reduction. So they took the ankle, you can kind of see me on this little poster behind me, and they cut right here, and they opened up the ankle, and they put in, I believe it was 3 plates and 7 screws. So they also had radiology in there, and radiology was helping them like position the screws right, and it was super cool, because I actually had that surgery done when I was in 8th grade, and I was finally able to see what they had done to my own body. So that was just an amazing opportunity. And definitely don't be afraid to ask. Like, there are a lot of opportunities that people miss out on because they're afraid to ask. And the only reason I was able to go into the OR is because I asked HR and I got my clearances done. So definitely don't be afraid to ask in this medical field. Like, there are so many opportunities you'll miss if you don't ask for them. It's very competitive, and the more experience you have, the better you are and more likely you are to get into medical schools. The first rotation I did was called the Spine and Pain Department, and I got to shadow a physician, and I walked around with him while he was doing some consults, and it was mostly just some pain and issues in the spine, some neurological issues. There's a lot of like compression of the spine, and I got to sit in and just listen while he talked to the patient and either adjusted their meds or just gave them a consult. And that was pretty interesting because I had never like observed a doctor and what they do back in their offices between consults, and it was kind of eye-opening. So wasn't my favorite rotation, but it was fairly interesting. And yeah, it was a lot of issues just with a lot of elderly people and some issues that they have if they had like a career that had them do like a lot of lifting, that would cause some back issues. And so it was a lot of people who had like construction jobs, and I just got to observe what the doctor did as he like approached a patient, and just that got to see what he does after that tiny little like 10-minute time slot of his appointments and what he did back in his office between those appointments. So that was a pretty different experience because not many people get to see what doctors do between their consults. The next department that I shadowed was occupational and physical therapy. And those dealt with a lot of athletes that were having issues with either muscle pains or joint pains. It was some elderly people who were just trying to like rehabilitate some muscles that were injured and just helping them get back into the shape that they were in. And I personally went through some physical therapy back when I broke my ankle that I referenced earlier, and it's a lot of doing stretches and just trying to work those muscles back into their prime shape. So as you guys know, when you use a muscle, it'll get stronger, and if you don't use the muscle, it'll start to deteriorate. So I was in a cast for 4 weeks and a splint for 2 weeks, and then I was in a walking boot for another 4 weeks. And so my muscles in that particular leg that I broke on my right leg were pretty diminished compared to the other leg. And so it took a lot of time for me to go through different stretches and strength exercises to get the muscles to even out again. And that's basically what physical therapy is. And occupational therapy is basically physical therapy, but it's pertaining to the hand, because the hand in itself is pretty complicated. You have a ton of muscles that radiate from around your elbow, and they go through to different fingers. So like one of the muscles will go to these 3 fingers and a different one will go to these 2. And fun fact, that's actually why you can't bend certain fingers without bending the other one. It's because of the connective muscle tissue. And so you have a special physical therapist that'll work with only the hand, and that's why they call it occupational therapy. And it's just, yeah, a ton of stretching, strength exercises. You do a lot of little like, yeah, just hand exercises to help the muscle to regain the strength that they lost in whatever injury that you sustained. And these next rotations are actually my favorite. So this next one was the pharmacy, and we have a small little pharmacy at the top of our hospital on the 3rd floor. And I shadowed a pharmacologist, and it was really cool. He showed me all of the different medicines, and he even showed me some of the chemo units, because chemotherapy medications are actually kept in a separate room, and they're refrigerated, and they're kind of kept in an own locked special room. And he showed me how they like mix different medications and where they store the medications, and then what they would do before they give the medications to a patient. And it was fairly interesting as well. I mean, I didn't understand what all the different medications were yet, but there were a ton, and it was just a ton of information coming at me at once. That was something that I've learned throughout all my rotations. Just a ton of information that you're trying to pack into your head in the 2 hours that you get with the doctor. And I've learned it's important to have questions at every rotation. The doctor will think more highly of you if you have some questions for them. They'll be more impressed if you're more engaged and you're keeping conversation with them. Don't let them talk to you the whole time. You know, give them some feedback on what your opinions and what you're learning, and ask them questions. They definitely love that. And that's something that I was trying to do in my pharmacy rotation, and it really helped me. My next rotation was the lab, and I've actually had experience on both sides of the lab now. So as a volunteer taking labs down to the lab, and now I've also observed physicians that are in the lab. And this was fascinating to me. So they came back, they let me look at some cells underneath a microscope, and they showed what they did to like blood samples and how they put them through the machines and how they worked and how they got the results back. They showed me a couple of different medications that they keep back there. They showed me the blood lab, and I loved it. I was fascinated. And the specific person that I was shadowing also had taken his MCATs, so what he ended up doing at the end when he realized that I wanted to become a doctor was he took me back into his office and he showed me his Princeton review book for studying for his MCATs, and he actually got a really good score in his MCATs, and he gave me some really good tips for how to study for your MCATs. And although I haven't taken them yet, I can share those just those little tips with you guys if you would like at a later date. Just let me know in the comments below. And he just went through the book with me, and he shared some really important information. So in a hospital, along with the lab where they take tests and they do tests on the blood samples and the different urine samples and stuff like that, they also have what they call an outpatient lab. And that's where patients will come in, and it's really quick. It's only about 2 minutes, but they'll come back into this room and they'll take blood samples, and they get a ton of blood samples every day. It's just quick in and out. And so I observed this lady named Tara, and she showed me how to start IVs and do the blood samples and draw blood, and it was really interesting to me because that's a fundamental skill for doctors. And you really need to know, like where the veins are and where you can get good blood. Because for different people, there's different spots that work better. So you need to know where you can get a good sample for blood for your results, because if you don't get enough blood, then the lab's gonna get mad because they don't have enough blood to do the sample and do the tests that they need. And so it's better if you know how to do it right. And you always hear the patients that complain about the doctors or the physicians or the nurses that don't know how to draw blood. And it's just much easier if you know how. And it really helped me because she showed me some really good tips on how to draw blood. So I also shadowed in the emergency department, and the emergency department kind of gets a bad rap because some of the nurses tend to be a little wound tight. They tend to, people tend not to think of them as the nicest people, and I did get a couple of the students that I shadow with who said that, but I personally had a great experience with them. I just offered to run some labs down for them to the lab, and it seemed to get me on their good side. And so yeah, they just talked to me a little bit about what their job is like. It's a very, very quick paced department, so you get a little bit of everything. You have some elderly people who may have like fallen and slipped. They would technically be considered a trauma if they're over the age of 60. So you get some of those. You get a ton of just a lot of paramedics that come through. You have to be very familiar with terminology because you'll have paramedics that come through and they'll be explaining patient history and what happened in the patient's incident, and you have to know what they're talking about. And so that was a little bit overwhelming for me because I didn't know all of the vocab that they were using, but it was fascinating to watch. So the ER is kind of a mix of every department. Once a patient gets situated and they have a diagnosis in the ER, they'll send them to other departments of the hospital. So you could have someone that comes into the ER with a broken bone and then they'll get transported to radiology. Or they could have the flu and they'll get transported to med-surg or the ICU. And so it's kind of like the only department in the hospital that transports patients to every other specialty. So you have specialists coming from all over the hospital to do consults, and it's kind of a crazy busy department, which is why the nurses tend to be uptight. But considering their stress load and how much is going on in the department, it's understandable. That's what I'm going to say about the department, but it's a fascinating department, and like I said, I really like quick-paced stuff, so I really liked the ER. And that's why I think some of my other fellow students didn't like the ER, because they weren't used to that. They weren't used to the nurses, and they didn't know how to get on the nurses' good side, I guess. But yeah, if you do the right thing and you are calm and collected and you ask questions and you offer to do stuff for the nurses or you offer to help them, they tend to like you. So it shouldn't be that big of a deal. The last department I want to get into is called the SPD for short, or it's the sterile processing department. And basically that's when you get all of the surgical instruments. Usually the sterile processing department is held a floor below the OR, and they have a little elevator system. So the OR will put all of their dirty instruments, they'll spray them off with like an antibacterial spray, and they'll send them in the elevator down to the sterile processing department. And then the sterile processing department has this whole big system for what they're supposed to do for every different instrument. So you get like your scopes, like your arthroscopes, and your different cameras and scopes that you use for like either colonoscopies or endoscopies or arthroscopic surgeries, and those get hand washed and they're their own separate part. But then you get like your scalpels and your retractors and stuff, and they all go into like this big oven, and it heats up all of the instruments, and it will basically kill off any of the bacteria that's on it. And then after that, there's a whole big process of how you're supposed to like take them out of the oven and then hand clean them and then repackage them and send them back up to the OR. And then you're supposed to also like make little kits, so they have like kits that are specially for different surgeries. And then there's special tape that they use to tape up these packages, and if they're sterile, the tape will be a certain color. If they're not sterile, then the tape will be a different color. So the OR will know if the package isn't sterile, and then they'd have to send it back down to the sterile processing department and get a new package. And so it kind of shows how the hospital's a big system, and everything has to be working properly or it doesn't function. And how you don't think about every job that goes into a hospital. Like you need all of the jobs. You need the janitors to keep all the rooms clean and to keep everything moving. You need the nurses because they're really the ones that have the face-to-face interactions with the patients. You need the doctors. You need the people to keep the instruments sterile. You need, like, there's so much that goes into a hospital, and that's what I've been learning through all of my rotations, is that you don't realize all of the departments that are in a hospital, and you don't realize how much work is put in for every single patient. And I think that's a big thing that you don't realize unless you're actually in the hospital. And I hope that you guys all get this experience, because for me personally, it's been amazing and it's helped me learn so much. So the two departments that I haven't gotten to yet in my rotations are the OR, which I talked a little bit because I have seen a few procedures in the OR from my volunteering, and what they call the APU, the Ambulatory Processing Unit, and that's for like minor procedures that you can go home afterward for. So like endoscopies and colonoscopies are the two biggest things that you see in the APU. So I'll be seeing both of those towards the beginning of December, and I'll try to keep you guys updated. But again, just let me know what you guys would like to hear about. Stay updated on my Instagram. Definitely leave comments below on what you guys would like to hear, and subscribe and like my page. Just help me build this community that'll help us learn about medicine. Thanks. Bye.